Welcome back to The Explainer. I'm so glad you're here today because we're about to do something pretty incredible. We are literally going to step into the scrubs of a registered nurse for a full 12-hour shift. Now, if you've ever spent time in a hospital, you've definitely seen nurses moving at lightning speed. But what you probably don't see are the immense, highly complex frameworks operating behind every single decision they make. Today, we're going to unpack the intense physical, intellectual, and emotional labor that actually goes into patient care.
Which brings us right to the big question, doesn't it? What does it actually take to safely manage the sheer chaos of a 12-hour nursing shift? On the surface, it just looks like a blur of medications, flashing alarms, and endless charting. But, beneath that surface is this rigorous bedrock of science, psychology, and unyielding safety protocols. So today, we're going to set the stakes and explore the exact theoretical and practical responsibilities that keep the entire medical system, and of course the patients, alive.
Okay, let's dive right into this. Here is our roadmap for today. We'll be covering the foundations of nursing, prioritizing patient needs, applying the nursing process, infection control, and finally, quality and professional standards. Section 1. The Foundations of Nursing, 7 a.m. Bedside Report.
All right, picture this. It's 7 a.m. The hospital is absolutely buzzing. Before our nurse even officially kicks off, they're getting the bedside report. But everything they do from this second forward is governed by the ANA's scope of practice. Think of it as the ultimate playbook, the who, what, where, when, why, and how of their entire job. Fundamentally, nursing is all about optimizing health, alleviating suffering, and fiercely advocating for patients. And a massive chunk of that is rooted directly in fundamental ethical principles. We're talking about beneficence, actively doing good, and non-maleficence, doing absolutely no harm. You add in respecting a patient's autonomy and fighting for fair justice and care, and you've got the core guide directing our nurse as they start planning out their day at 7:30 a.m.
Actually, to really grasp this modern scope of practice, we kind of have to look back. In 1890, Florence Nightingale, the founder of modern nursing, recorded this incredibly powerful message. She famously pioneered statistical analysis and healthcare reform way back during the Crimean War. And while her legacy today is recognized as being pretty complex, including her noted support of British colonialism, her initial vision for health reform fundamentally shaped the standard, rock-solid protocols our 7 a.m. nurse relies on to this very day.
Section 2. Prioritizing patient needs. 8 a.m. triage. Okay, it's 8 a.m. The nurse steps onto the floor, alarms are blaring, call lights are flashing everywhere. How in the world do they decide who gets care first? Well, they rely on Maslow's hierarchy of needs. So the crucial point here is how this famous psychological theory actually becomes a literal life-saving triage tool right there on the hospital floor. You simply cannot reach those top tiers of psychological well-being until the foundational baseline needs at the very bottom are completely 100% satisfied.
The contrast you see in a single shift is just wild. Right at the start, the nurse is focusing entirely on the absolute baseline, physiological needs. Is the patient breathing? Are their vital signs stable? Do they have oxygen, fluids? That has to be handled first, no exceptions. But by the end of the shift, if those vital functions are locked in and stable, the nurse is striving for that highest tier, self-actualization. This is where they empower the patient, giving them the exact information and confidence they need for a successful discharge home. It's a massive spectrum of care to manage in just one day.
Section 3. Applying the nursing process. 9 a.m. Action Plan.
Fast forward, it's now 9 a.m. The mid-morning rush is in full swing, and complex patient problems are popping up left and right. To solve them, nurses apply a very specific scientific method known by the acronym ADPI: Assessment, Diagnosis, Planning, Implementation, and Evaluation. According to the foundational texts, this brilliantly illustrates a structured cyclical blueprint. Think of it like this. First, they assess the patient's physical condition. Then, they diagnose the human response to that specific medical condition. They plan the outcomes, implement the medical interventions, and finally, evaluate if it actually worked. And if it didn't, the whole cycle starts right back over again. It's rigorous, continuous scientific thinking applied directly at the bedside.
Section 4. Infection Control and Safety, the Invisible Shield.
Now, throughout this entire 12-hour shift, while the nurse is administering all this care, there is a constant underlying threat lurking in the room: the invisible enemies of healthcare-associated infections and, frankly, human error. To fight this, the CDC mandates standard precautions as the absolute bare minimum infection prevention baseline. And here's why this matters so much. These rules apply to all patient care,
completely regardless of a patient's suspected or confirmed infection status. A nurse always has to assume that transmission is possible. This is the baseline invisible shield designed to protect healthcare personnel and stop the spread of infection among highly vulnerable patients.
Let's break down the CDC's exact rules for hand hygiene, because this is the cornerstone of patient safety. You might assume good old soap and water is always best, right? But surprisingly, alcohol-based hand rubs are actually preferred in most clinical situations. Why? Because they're way faster, less irritating to the skin, and highly effective against a massive spectrum of pathogens. However, and this is a big however, our nurse must switch to traditional soap and water if their hands are visibly soiled or if they're dealing with specific super-resilient outbreaks like C. difficile or norovirus. Knowing exactly when to use which is a constant split-second decision.
What's actually amazing is that these modern CDC environmental cleaning guidelines connect straight back to the 1860s. Nightingale's environmental theory heavily prioritized fresh air, clean water, and strict cleanliness of the patient area. And remember, she conceptualized all of this during a time before antibiotics or antiseptics were even a blip on the radar. By aggressively managing the physical environment, nurses literally create the optimal space for the patient's body to heal itself.
Moving on to another massive patient safety factor, injection safety. The CDC's One and Only campaign shines a light on a pretty frightening reality. Outbreaks still happen in outpatient and hospital settings simply due to unsafe injection practices. The absolute golden rule here? Never, ever use a single syringe to administer medication to multiple patients, even if you change the needle. Nurses have to meticulously navigate vials, syringes, and IV lines to ensure absolute sterility every single time.
Section 5. Quality and Professional Standards, 2 p.m. to 6 p.m.
All right, we're moving into the late afternoon. The immediate morning crises are finally stabilized, and the nurse can start looking toward continuous improvement using the QSN competencies. That stands for Quality and Safety Education for Nurses. Let's see how this builds into the broader healthcare system. This is the overarching framework, ensuring that nurses don't just treat the one patient sitting in front of them, but actually improve the system itself. They're constantly analyzing evidence-based practice, collaborating with huge interdisciplinary teams, and using complex informatics to guarantee that safety isn't just a corporate buzzword, but a measurable daily reality.
Finally, it hits 6 p.m., the final hours of the shift. The critical medications are given, the assessments are logged. Now the nurse finally has a moment to focus heavily on those higher tiers of Maslow's hierarchy we talked about earlier. They work on love and belonging by facilitating family visits. They focus on self-esteem by providing dedicated education so the patient truly understands their own care. And, of course, they are finalizing exhaustive charting to make absolutely sure the next nurse coming in at 7 p.m. has every single piece of data they could possibly need.
Which brings us to the end of our shift, and really to this final thought. We've traced the invisible frameworks today, from Maslow's triage and the ADPI scientific method, right through to strict CDC infection shields and QSEN safety protocols. Knowing the immense physical, intellectual, and emotional labor required to execute just one single 12-hour shift, how does this change your view of the nurse standing at your bedside? It is a profoundly complex profession built entirely on protecting us when we are at our most vulnerable. Thank you so much for joining me on this explainer. I hope it completely shifted your perspective. Keep learning, and I'll catch you next time.